Patrick. I'm a junior nursing student. I've never studied abroad, and I guess the reason why I wanted to come on this trip was to get a sense of the culture, get out of the U.S. for once, since I never go anywhere. Also, it kind of pushed me to do things that I wasn't really comfortable with, so it was a good experience to get out of the comfort zone.
Hi, I'm Moira Carmen. I'm a junior in the nursing program. I've never studied abroad before. I've done some personal travel. I always regretted not studying abroad in my first undergrad, so I thought this would be the perfect opportunity to do a short intersession trip and be able to provide service to another country that needed it while learning abroad.
Hi, my name is Caitlin Lyons. I'm a junior at the University of Buffalo. I've never studied abroad before, so I decided to come to Belize because I always wanted to see how other countries' healthcare systems work, and I just thought it would be a good experience to see the kind of conditions other nurses had to work in.
Hi, my name's Corinne. I wanted to come on this trip because I thought it would be a really good experience, and I've never really had the chance to travel before.
Hi, my name is Julia Biscaglia. I'm a junior at University of Buffalo School of Nursing. I decided to study abroad because I wanted to get outside of myself and help other people. I feel like a lot of times just being in school, I'm focused on what I have to do and what I have to get done, and it's good to not think about yourself for a little while and take care of other people. It makes you appreciate what you have and what other people need. I've never studied abroad before, so I really appreciate this opportunity.
Hi, my name is Barbara Prescott. I'm currently a junior major at University of Buffalo School of Nursing. I guess I really wanted to come to Belize because I never thought I'd have an opportunity to study abroad with the curriculum that we have in the nursing program. I've always been curious about how different cultures value their healthcare, and I've really been learning about that here. I have studied abroad or traveled abroad before. I went backpacking through Europe this past summer, but I've never been in Central America before, so this has been a really great opportunity for me so far.
Hi, I'm Chelsea Armstrong. I'm a part of the traditional nursing program at the University of Buffalo. I've never had the chance to study abroad for anything, and I've always been interested in doing a medical mission, so I thought when this opportunity arose to travel to Belize with the nursing program, I saw it as the perfect chance to do that. I wanted to see how different the healthcare was here and how the hospitals worked, the clinics worked, how the people were in general. So I'm just really glad to be here, and I would definitely recommend it for anyone else who had the opportunity to do so.
So, in describing the culture, food, transportation area, and weather of Belize, I have to say that with food, the main dish is chicken, and we had a lot of different variations, baked, fried, and then we also had one that we had often, which was like an orange sauce, a lot of veggies, fried plantains, steamed vegetables, also a lot of rice and beans and rice are different things there, which we learned, which was a new thing that I didn't know about. Our transportation was a bus, but it seemed like the majority of people who lived in Orange Walk or in the villages either walked or rode bikes. There were cars, there was a lot of trucks though, but there was still a lot of pedestrians, more than I would say we see in Buffalo. The weather the majority of the time was mid-70s, sometimes low 80s, mid-80s. To us it was very warm and comfortable, but to our ISL leader and the locals, they said that it was freezing. It was actually a cold spell for them, which was surprising.
I saw a lot of patients
The areas
with
we were in,
uncontrolled
Orange Walk,
diabetes and hypertension.
was like the center town that we were in the majority of the time. And the villages like San Lazaro and San Jose and Carmelita were smaller villages. They were less busy, had less people. Those are kind of the differences. With culture, I'd have to say that everyone is extremely friendly, open, willing to talk to you. So that was a nice thing to come to Belize and experience because it made you comfortable to be there for sure. So while in Belize, the types of diagnoses that I saw and treated were a lot of uncontrolled high blood pressure, diabetes, also a lot of skin infections like fungal, scabies. And then to treat them, we would give obviously creams or antibiotics. Patient education was also a way, I guess you could say, we treated, by saying, explaining why they had these things or how they needed to take care of them over time or what was causing them, such as the high sodium or canned goods that they eat a lot there. We thought was probably a reason why the locals were having such trouble with high blood pressure.
There's plenty to say when it comes to the differences of healthcare in the United States and Belize. First off, there is a very small percentage of people with health insurance in Belize because of the cost. We were told that only people with very prestigious jobs are able to afford the health insurance plans offered in the country. Here in the United States, the majority of people have health insurance, and there's currently a goal to have everyone insured at one point or another. Secondly, would be the use of hospitals and access to them in Belize and how we use our hospitals in America. Hospitals in Belize are not only used for an inpatient facility, but also for primary and secondary care. There is no such thing as primary care physicians in Belize. You go to the hospital to receive a physical or any other basic illness that needs to be treated, along with the service that hospitals normally provide. The main issue with all the medical care only being provided in the hospitals would be the lack of access people living in places such as the distant villages have to receive the care. The people who live in these villages are usually very poor and do not own any vehicles of their own. The bus routes do not go out as far as these villages, so people who are feeling ill either have to ask someone with a vehicle to drive them to the hospital or walk to the closest bus stop. It also does not help that the ambulances in Belize are far from reliable. We were told by a physician that anyone could call for an ambulance if they have access to a phone, but there is no guarantee that the ambulance would ever show up. You also have to pay a fee for this service, which most of these villagers do not have the money for. To expand on this, there is only one hospital in Belize, located in Belize City, that has more advanced diagnostic tools. Therefore, if the individual is able to make it to the local hospital, if he or she needs further testing, such as an MRI or CT scan, a trip to Belize City would have to be made. The town we stayed in, Orange Walk, was about an hour and a half from Belize City. This is a long trip for people with limited forms of money and transportation. The last point I will touch on is prescription and over-the-counter medications in Belize. In America, we have our medications prescribed by our doctor, where we usually pay a copay and have the rest covered by insurance. Or if we have a simple headache, we can take a short drive to the local CVS and pick up a bottle of ibuprofen with 300 pills for a few bucks. In Belize, you pick up all your prescription medications from the hospital, and they're usually free of charge. But again, the main issue is being able to get to the hospital. So many patients we had in the clinics in the different villages we worked in came in with out-of-control blood pressure or glucose levels. When asked if they're on medication, the most common response was yes, but I ran out and haven't been able to get to the hospital. There was also a huge lack of proper education regarding these disorders and the proper treatment of them. When it comes to over-the-counter medications in Belize, you are able to get them from most grocery stores and gas stations, but they are outrageously expensive. For 2 ibuprofen, it ranged from around 10 to 12 US dollars. It was around the same cost for 2 tablets of any basic antacid or antihistamine. These are only a few of the many differences of healthcare in Belize compared to the United States. Belize is still a developing country, and this is overwhelmingly obvious by looking into their healthcare system.
While we were in Belize, the things that we did were, we had our general orientation. We learned a lot about Belize and the culture and the history. We had a Spanish lesson. Then we went to San Lazaro and handed out tickets for appointments. And the next day, we went back to San Lazaro, had our clinic, had a bunch of patients. What we did specifically as the nursing students is we did health assessment and physicals. We listened to lung sounds, blood pressure, temperature, pulse, and asked a variation of questions to kind of find out what the main complaint was and the patient's history, kind of get a general idea of what might be wrong. Then we would go into the doctor's office with the patient and report off, say this is what we think is going on with the patient. Then the doctor would ask the patient the questions. He would usually write a script for medication depending on what he thought it was, or referrals to the hospital for specific procedures or tests. And this is what happened in San Jose as well, which is another village we visited. In Carmelita, it was a little different. We didn't have a clinic, but we had a health fair, which went really well. You know, we did oral and hand hygiene, exercise and nutrition, and we also had a bunch of posters on tropical diseases. And we had a big group of people come around, and we did our, I guess, like our speeches, you could say. And we had them ask questions. So, and then the last day, we went to Key Cocker, which is an island. You know, we went snorkeling and hung out. So that was fun as well.